Workplace safety. So after this lesson, you should be able to define common terms as they relate to workplace safety, including OSHA, USP, and NIOSH. Understand measures that a pharmacy technician can take to protect themselves and patients from unnecessary exposure to infectious agents or hazardous materials. Identify resources for the handling of exposure to hazardous materials or infectious agents. So we're going to start with OSHA. OSHA is the Occupational Safety and Health Administration. They're responsible for establishing safe and healthy workplaces around the country. So part of OSHA's job is to predefine certain rights that all workers have. One of these is the worker's right to know what hazards they may be exposed to in the workplace. So at any pharmacy you're employed at, you have the right to know what things could harm you, such as medications or products used for compounding. So if there's ever a concern about what you may be exposed to or what things could be hazardous to you, make sure you reach out to your management for this. Part of that is material safety data sheets. So MSDS, or material safety data sheet, like I said, are an important part of the right to know law. Ensure that your pharmacy has an MSDS for any chemical you may be handling. The MSDS will provide information on the risks of handling a chemical, as well as what to do if you are exposed to that chemical. Next, infection control. OSHA also works with the CDC to provide infection control guidance in the workplace. Some recommendations include hand washing, personal protection equipment, bloodborne pathogen protection, and respiratory protection. Hand washing is one of the most effective ways that you can limit the spread of infectious disease. OSHA requires that employers provide employees with hand washing facilities that are readily available. You as an employee should wash your hands with soap and water for at least 30 seconds after using the restroom, handling biohazard materials, or taking off gloves. Now, bloodborne pathogens. OSHA requires that employers have an exposure plan that is updated annually for bloodborne pathogens. Employers are also required to provide PPE, or personal protection equipment, or personal protective equipment, and hepatitis B vaccines if workers are at risk of being exposed. Employers must also provide post-exposure prophylaxis or be able to get the employee to care should an employee be exposed to a bloodborne pathogen. And finally, if you're concerned that you will be or have been exposed to a bloodborne pathogen, make sure you speak with your employer immediately. So your pharmacy may also have an eye wash and shower station. Employers are required to provide employees with an adequate space to flush the eyes or body should they be exposed to hazardous chemicals. This may be a full eye wash and shower station or a simple eye irrigation station. Make sure you're aware of where your pharmacy's eye wash or shower station are before handling hazardous chemicals. So they may be like the ones that I have shown here where they're the full body and shower combo, or they could be something as simple as an eye wash station on the wall. Finally, every pharmacy handling hazardous chemicals should have a spill kit on hand to handle spills safely. Your employer should also have a plan in place in the event of a hazardous spill. If a hazardous spill happens while you are at the pharmacy, be sure to know not only where the spill kit is, but your role in the containment plan before handling the situation. So it's really important not to just work on the fly, but to know what your purpose is so that you can help the team in the best manner possible. So if your job is to get the spill kit, or if your job is to call someone, make sure that you know that role and can fulfill it. Now we're going to discuss USP, or the United States Pharmacopoeia. It was established to provide standards for compounding, manufacturing, the handling of hazardous drugs, and more. Although they established those standards, they are not an enforcing body. So state boards of pharmacies may adopt USP standards and then enforce them. So they write these standards and work together to form these guidelines. However, they do not have the power to go in the community and really enforce them. That's where the state board of pharmacy, it's up to them to enforce them. So starting with USP 795, it sets forth standards for non-sterile compounding. These standards include safety recommendations such as removing all jewelry, pulling hair out of the face while compounding, only compounding one medication at a time, and ensuring clean facilities. Many state board of pharmacies, as well as PCAB or the Pharmacy Compounding Accreditation Board, use USP 795 for certification and regulatory purposes. By following USP 795, you are ensuring that not only you are safe, but the patient is safe from any kind of contamination. So this is really looking at making sure that you're not mixing two medications in the same space to where the powder could get into the other medication. Making sure that you don't have jewelry on or hair in your face that could end up getting into the medication. Making sure that you're wearing gloves so medications aren't getting on your skin. Things like that. Next we have USP 797. So USP 797 sets standards for both sterile compounding as well as the regulations for sterile compounding facilities. So these recommendations also entail the testing required before a pharmacy technician may sterile compound to ensure that they have adequate aseptic technique. So following USP 797 standards are extremely important for your safety and the patient's safety. By ensuring safe following of USP 797, you will reduce your own risk of needle sticks and will protect the patient from any systemic infections or dangers. So this one's a really important one. A lot of times when you're working in a sterile environment, you'll also be working with needles. So making sure that you are up to date with your aseptic technique to ensure that you're not getting stuck with those needles. Because unfortunately, if the environment is not sterile, there's a chance that you will then contaminate yourself and give yourself an infection. And then likewise, putting those needles into an IV bag per se that will then be infused into a patient's blood. If the environment's not sterile, we just gave the patient an infection. So it's really twofold to protect you as well as to protect the patient. Next, we have USP 800. USP 800 sets standards for the handling of hazardous drugs. So this includes setting standards for the storage of hazardous drugs. All hazardous drugs must be stored separately from their non-hazardous drugs counterparts. USP 800 also includes information for the facility requirements for hazardous compounding, including having a separate compounding area and separate cleaning equipment in order to decrease risk of contamination. We'll discuss NIOSH. NIOSH is the National Institute for Occupational Safety and Health. They publish a list of hazardous agents and antineoplastic agents to protect healthcare workers from exposure. That word's a mouthful. They also publish recommendations for personal protective equipment, or PPE, like we discussed earlier. Agents are classified into groups there from Group 1, which is antineoplastic groups, Next, we'll discuss NIOSH, so the National Institute for Occupational Safety and Health. They publish a list of hazardous agents and antineoplastic agents to protect healthcare workers from exposure. They also publish recommendations for personal protective equipment, or PPE. And then agents are classified into groups by NIOSH, so Group 1s are the antineoplastic drugs. Group 2 are non-antineoplastic drugs that meet one or more of the NIOSH criteria for a hazardous drug. And Group 3 are non-antineoplastic drugs that primarily have adverse reproductive effects. So in conclusion, organizations such as OSHA, USP, and NIOSH produce laws, recommendations, and standards in order to protect both you and patients in the workplace. By following these guidelines, you are ensuring that you are safe and that your patients are safe. Failure to follow these guidelines can result in legal issues, termination of employment, or even death. So this is a super serious one. Make sure you guys pay close attention to your workplace safety, take it seriously, and stay safe.